Welcome to today's Medicare 360 show. I'm Jennifer Lee, your host. We are still continuing with our Medicare New Handbook for 2025. So let's get started. We are at page 34, and we are on the chronic pain management and treatment services. Medicare covers monthly services for people living with chronic pain, persistent or recurring pain lasting longer than 3 months. Services may include pain assessment, medication management, and care coordination and planning. The Part B deductible and coinsurance applies. Clinical research studies. Clinical research studies test how well different types of medical care work if they're safe, like how well a cancer drug works for certain clinical research studies. Medicare covers some costs, like office visits and tests. You may pay 20% of the Medicare approved amount depending on the treatment you get. The Part B deductible may apply. Moving forward to page 35, we're still on finding out what Medicare covers. Note, if you are on a Medicare Advantage plan, original Medicare may cover some costs along with your Medicare Advantage plan. Contact your plan for details about coverage for clinical research studies. Cognitive assessment and care plan services. I believe this is a really big one that I've been seeing just more cases, and in my own life have been experiencing this with my loved ones. When you visit your provider, including your yearly wellness visit, they may perform a cognitive assessment to look for signs of dementia, including Alzheimer's disease. Signs of cognitive impairment include trouble remembering, learning new things, concentrating, managing finances, or making decisions. Conditions like depression, anxiety, and delirium can also cause confusion, so it's important to understand why you may be having symptoms. Medicare covers a separate visit with a doctor or healthcare provider to do a full review of your cognitive function, establish or confirm a diagnosis like dementia or Alzheimer's disease, and develop a care plan. You could bring someone with you, like a spouse, friend, or caregiver, to help provide information and answer questions. During the visit, the doctor or healthcare provider may perform an exam, talk with you about your medical history, and review your medications. Identify your social support, including care that your usual caregiver can provide. Create a care plan to help address and manage your symptoms. Help you develop or update your advanced care plan. Go to pages 30 to 31. Refer you to a specialist if needed. Help you understand more about community resources like rehabilitation services, adult day health programs, and support groups. The Part B deductible and coinsurance apply. Some people living with dementia and their family and unpaid caregivers may be able to get additional support through the Guiding and Improved Dementia Experience Model Pilot Program. Talk to your provider for more information and find out if they participate. Preventive service, colorectal cancer screenings. Medicare covers these screenings to help find precancerous growth or find cancer early when treatment is most effective. Medicare may cover one or more of these screening tests. Computed tomography, colonoscopy. Medicare covers a screening test once every 24 months if you're 45 or older and at high risk for colorectal cancer. If you aren't at high risk, Medicare covers the test once every 60 months or 48 months after a previous sigmoidoscopy or colonoscopy. You pay nothing if your doctor or other healthcare provider accepts assignment. Okay. Now on to page 36, flexible sigmoidoscopies. Medicare covers this test once every 48 months if you're 45 or older, or 120 months after previous screening colonoscopy if you aren't at high risk. You pay nothing for the test if your doctor or other qualified healthcare provider accepts assignment. So the keyword's always accepting assignment. If your doctor finds and removes a polyp or other tissue during the colonoscopy or flexible sigmoidoscopy, you pay 15% of the Medicare approved amount for your doctor's services. In a hospital outpatient setting, you also pay the hospital a 15% coinsurance. The Part B deductible doesn't apply. Fecal occult blood test. Medicare covers a screening test once every 12 months. If you're 45 or older, you pay nothing for the test if your doctor or other qualified healthcare provider accepts assignment. Multi-target stool DNA and blood-based biomarker test. Medicare covers these screening tests once every 3 years if you meet all these conditions. You're between 45 to 85. You show no symptoms of colorectal disease, including but not limited to lower gastrointestinal, oh gosh, I can't pronounce it, gastrointestinal pain, blood and stool, a positive GUAC, GUAIAC, fecal occult blood test, or fecal immunochemical test. So that's why I never became a nurse or a doctor. Um, I could offer health insurance, no health insurance in Medicare, but I just uh, speaking bio and chemicals and formulas and no can do. Okay. So you're at average risk for developing colorectal cancer, meaning you have no personal history of adenomatous polyps, colorectal cancer, or inflammatory bowel disease, including Crohn's disease and ulcerative colitis. You have no family history of colorectal cancer or adenomatous polyps, familial adenomatous polyps, or hereditary non-polyposis colorectal cancer. Multi-target stool DNA tests are at-home lab tests. Blood-based biomarker tests are conducted in a lab. You pay nothing for these tests if your doctor or other qualified healthcare provider accepts assignment. Continuous positive airway pressure CPAP devices and accessories. I have seen this come often with clients. Medicare may cover a 3-month trial of CPAP devices and accessories if you've been diagnosed with obstructive sleep apnea. After the trial period, Medicare may continue to cover CPAP devices and accessories if you meet with your doctor in person and your doctor documents in your medical record that you meet certain conditions and the CPAP is helping you. You pay 20% of the Medicare approved amount for the machine rental and the purchase of related supplies like mask and tubing. The Part B deductible applies. Medicare pays a supplier to rent the machine for 13 months, been using it without interruption. After you rented the machine for 13 months, you'll own it. Note, Medicare may cover a rental replacement CPAP machine and or CPAP accessories if you had a CPAP machine before you got Medicare and you meet certain requirements. So I would say for this, just make sure that if you are on a CPAP machine and you do move from plan to plan, not necessarily the Medicare supplement plans, but the Medicare Advantage plans, depending on when you got your CPAP machine, if it's less than the 13 months or over the 13 months, really depends if that vendor wants you to return it, pay for it, and then you would have to get another CPAP machine from the new vendor with a new insurance carrier. Keep that in mind. Some have co-pays, co-insurance on that. Some don't. It just really depends on plan to plan. Okay. So think, have I note, Medicare may cover a rental or replacement CPAP machine and or CPAP accessories. If you had a CPAP machine before you got Medicare and you meet certain requirements. I already read that. Okay. Preventive services. Counseling to prevent tobacco use and tobacco-caused disease. Medicare covers up to 8 face-to-face visits in a 12-month period if you use tobacco. You pay nothing for the counseling sessions if your doctor or other qualified health provider assigns assignments. COVID-19, coronavirus disease 2019. Many people with Medicare at a high risk for serious COVID-19 illness, so it's important to take the necessary steps to keep yourself and others safe. Medicare covers several test items and service related to COVID-19. Talk with your doctor or other healthcare provider to find out which are right for you. COVID-19 vaccines. FDA approved and FDA authorized with vaccines help reduce the risk of illness from COVID-19 by working with the body's natural defenses to safely develop immunity protection against the virus. You pay nothing for the COVID-19 vaccine if your doctor or other qualified healthcare provider accepts assignment for giving you the shot. Be sure to bring your red, white, and blue Medicare card with you when you get the vaccine, or your healthcare provider or pharmacy can bill Medicare. If you're in a Medicare Advantage plan, you must use a card from your plan to get your Medicare coverage services. You pay nothing when you get the vaccine from an in-network provider. Check with your plan for more information. Diagnostic laboratory test. So I think we may have gone over these last week, but that's okay. Sometimes we need to just we go over it, right? So, diagnostic laboratory tests. These tests check to see if you have COVID-19. You pay nothing when a healthcare provider orders this test, and you get it from a lab, pharmacy, doctor, or hospital that takes Medicare. If you're in a Medicare Advantage plan, check with your plan and find out if you have any out of pocket costs. Monoclonal antibody treatment and products. These FDA authorized or approved treatments can help you fight the disease and help you out of the hospital. You must test positive for COVID-19, have mild and moderate symptoms, and be at high risk for progressing to severe COVID-19 and or needing hospitalization. Original Medicare will cover monoclonal antibody treatments if you have COVID-19 symptoms. You pay nothing. Okay, let's see. You pay nothing. Where am I at? For these treatments, when you get them from a Medicare provider or supplier, you must meet certain conditions to qualify. If you're in a Medicare Advantage plan, check with your plan about your coverage and costs. Certain FDA on certain FDA authorized or approved monoclonal antibody products can protect you before you're exposed to COVID-19. If you have Part B and your doctor decides this type of product could work for you, like if you have a weakened immune system, you pay nothing for the product when you get it from Medicare provider or supplier. Get more information, learn about these covered services at medicare.gov/Medicare-coronavirus. For more on COVID-19, visit cdc.gov/COVID. Defibrillators. Medicare may cover an implantable cardioverter defibrillator if you've been diagnosed with heart failure. If the surgery takes place in an outpatient setting, you pay 20% of the Medicare approved amount for your doctor's services. You also pay a copayment in most cases. The copayment can't be more than a Part A hospital stay deductible. The Part B deductible applies. Part A covers surgeries to implant defibrillators in an inpatient hospital setting. Go to inpatient hospital care on pages 27 to 28. Preventive service. Depression screening. Medicare covers one depression screening per year. Screening must be done in primary care setting like a doctor's office that could provide follow-up treatment and or referrals. You pay nothing for the screening if your doctor accepts assignment. If you or someone you know is struggling or in crisis and would like to talk to a trained crisis counselor, call or text 988, the free and confidential suicide and crisis lifeline. You can also connect with a counselor through web chat at 988lifeline.org. So this is very important. Mental illness is very important to catch and make sure that that there are screenings for this. So this is good. Diabetes equipment, supplies, and therapeutic shoes. Medicare covers meters and continuous glucose monitors used to estimate your blood glucose, blood sugar level, and related supplies including test strips, lancet holders, sensors, and control solutions. Medicare also covers tubing, insertion sets, and insulin for patients using insulin pumps, and sensors, transmitters, and receivers for patients using continuous glucose monitors. In addition, Medicare covers one pair of high, extra depth, or custom shoes inserts per year for more with specific diabetes related foot problems. If you pay 20% of the Medicare approved amount, if your supplier accepts assignment, the Part B deductible applies. Important. Medicare drug coverage Part D may cover insulin. Um, you inject yourself certain medical supplies and use to inject insulin like syringes, disposable pumps, and some oral diabetes drugs. Check with your plan for more information. The cost of 1 month supply of each covered insulin product is capped at $35. Go to page 88. Similar caps on costs apply for traditional use and Part B covered insulin pumps. So just on a side note about this, not really about the equipment or the supplies, but recently had a client who's taking three types of insulin. The carrier sent him a letter that basically he needed to get approval from his doctor to continue the prescription drug, and they were only going to prescribe temporary. But of course, when a client does look at that, does receive a letter, they're just like, oh, I'm not covered, right? So there are steps to that. What typically would be done is we could contact the carrier for you. The carrier then takes initiative action to follow up or contact the doctor's office so the doctor office can sign off on it and get that approved. So even sometimes when drugs are covered, there still needs to be some type of approval with the doctor, if that makes sense. Um, and of course, if it is not an approved drug, you can still make an exception and ask for that with the insurance carrier. And typically, they will send that to the doctor to see if it's something you really need. There are escalation processes to that, and of course, we could help on that. So let's move forward to preventive service on diabetes screenings. Medicare covers up to 2 blood glucose, blood sugar laboratory test screenings, fasting or non fasting each year. If your doctor determines you're at risk for developing diabetes, you pay nothing for the test if your doctor or other qualified healthcare providers accepts assignment. Diabetes is so rampant now, so much medication on that, but of course, a healthy eating lifestyle does definitely help. Diabetes self management training. Medicare covers diabetes outpatient self management training to teach you to cope with and manage your diabetes. The program may include tips for eating healthy, being active, monitoring blood glucose, blood sugar, taking prescription drugs, and reducing risks. You may have been diagnosed with diabetes and have written order from your doctor or other healthcare provider. Some patients may also be eligible for medical nutrition therapy services, page 45. You pay 20% of the Medicare approved amount. The Part B deductible applies. Note, if you are in a rural area, you may be able to get diabetes self-management training from a doctor or other healthcare provider through telehealth. Visit adcs.org/program-finder to find certified programs near you. Doctor and other healthcare provider services. Medicare covers medically necessary doctor services, including outpatient services and some inpatient hospital doctor services. Um, and most preventive services. Medicare also covers services you get from other healthcare providers like physician assistants, nurse practitioners, clinical nurse specialists, clinical social workers, physical therapists, occupational therapists, language pathologists, and clinical psychologists, except for certain preventive services for which you pay nothing. If your doctor or other provider accepts assignment, you pay 20% of the Medicare approved amount for most services. The Part B deductible applies. Important, if you haven't received services from your doctor or group practice in the last 3 years, they may consider you a new patient. Check with a doctor or a group practice to find out if they're accepting new patients. Drugs. Okay, so Part B covers a limited number of outpatient pers- uh, prescription drugs, like most injectable and infused drugs when a licensed medical provider gives them, certain oral anti-cancer drugs, drugs used with some type of durable medical equipment like a nebulizer or external infusion pump, intravenous immune globulin for use in the home, FDA approved pre exposure prophylaxis medication for HIV prevention, certain drugs you get in a hospital outpatient setting under very limited circumstances, most renal diseases, drugs, and biological products. And that's page 44. Note, other than the examples above, you pay 100% of the most for most drugs unless you have Medicare drug coverage Part D or other drug coverage. Go to page 79 to 90 for more information about Medicare drug coverage. For some drugs used with external infusion pump for intravenous immune globulin for in the home, Medicare may also cover services like nursing visits under the home infusion therapy benefit and the intravenous immune globulin benefit, page 44. Part B also covers some injectable or implantable drugs to treat substance use disorder when a provider administers them in a doctor's office or an outpatient hospital setting. You pay 20% of the Medicare approved amount for these drugs. The Part B deductible applies. You won't have to pay any copayments for these services if you get them from Medicare enrolled opioid treatment program, page 47. Doctor and pharmacies must accept assignment for Part B covered drugs, so you should never be asked to pay more than the coinsurance or copayment for the Part B drug itself. Important, your coinsurance can change depending on your prescription drug prices. You may lower coinsurance for certain Part B covered drugs and biologicals when you get them in a doctor's office or pharmacy or in a hospital outpatient setting. If their prices have increased higher than the rate of inflation, the specific drugs and potential savings change every quarter. So, I'd like to continue this next week on the Part B covered drugs. Till next time, I'm your host, Jennifer Lee with Medicare 360. Follow us on Instagram or Facebook. I look forward to have you join me next week. Take care.